I'm Dr. Molly Gordon from Baylor College of Medicine. I'm an associate professor of psychiatry in the Minigo department, and I'm the director of the anti-human trafficking program at Baylor College of Medicine.
And I'm Rachel Robitz. I'm a family medicine and psychiatry trained physician in the Department of Psychiatry and Behavioral Sciences at the University of California, Davis.
So we're going to talk further about human trafficking. So tell me, Dr. Robitz, why should psychiatrists care about human trafficking?
One of the things we know about human trafficking is that the International Labor Organization estimates that there are about 40 million victims of forced labor and marriage worldwide. And we know that trafficked individuals are seen within healthcare settings. So there was a study of both sex and labor trafficked individuals that found that about 67% of them were seen by healthcare providers while they're being trafficked. Another study of sex trafficked individuals found that about 80% of those individuals were seen in healthcare while they're being trafficked. So this is a problem that's likely more prevalent than we know. And we know that we as psychiatrists are seeing and interacting with victims of human trafficking all the time. We also know that trafficked individuals have significant mental health needs. They have diagnoses such as PTSD, anxiety, and depression. And what scares me the most is some of the statistics about self-harm. One study of sex trafficked adults found that about 40% of them had a history of a suicide attempt, and study of sex trafficked minors found that about 30% of them have a history of moderate to severe self-harm behavior. We also know that there are mental health consequences for both sex and labor trafficked individuals.
And what can psychiatrists do about human trafficking in their professional role?
Yeah, so I think it's important. We just got done having a session on human trafficking and what psychiatrists can do. And so what we're talking about today is a little bit about what we talked about in our session. But beyond that, psychiatrists can seek out education on human trafficking, learn a little bit about what it looks like, learn about how it might present in their settings. The Health and Human Services Office of Trafficking in Persons has an online web module, the SOAR to Health and Wellness module that you can get for free to learn a little bit more, increase your knowledge. I think once you've increased your knowledge, it's important to think about what does this look like in clinical practice. And so one of the things we talked about in our session earlier is the importance of developing a protocol within your health system. An organization called Heal Trafficking has a toolkit that can help you kind of think about how to do that so that you can be prepared for when trafficked individuals present in your health setting. In our session, you talked a bit about the work that you all are doing and the importance of having this kind of multidisciplinary and collaborative approach. And it was really exciting to learn about the work that you're doing, the work of some of our co-presenters, and how they're working with children. Dr. Shaylin Chalk talked about her work with children, and Drs. Kenneth Chung and Miriam Garuba talked about some of the legal rights of victims and the kind of the policy background that kind of overlays everything that we do.
Wonderful.
Yeah.
And do you see a lot of patients who've been trafficked in your practice?
Yeah, so I used to work as a psychiatrist for a couple of different trafficking programs. And so, I mean, clearly I was seeing trafficked individuals because I was working in their recovery. More recently, I work in both a primary care clinic as well as in a mental health urgent care. And I do see trafficked individuals in both of those settings.
And can you talk a little bit about the importance of integrated care in the patient population?
Yeah, so I mean, I'm a bit biased because I'm a double boarder, and so for me, you can't really address someone's physical health needs without addressing their mental health needs, and vice versa. But I think for this population, that's incredibly important because they oftentimes have comorbid medical and mental health and physical health issues, and really beyond kind of that collaboration and integration, there needs to be integration with social services because many of the individuals that I've served have a lot of very significant social needs that I as a physician need help with, and so it's great to partner with community partners.
Great.
Yeah.
Well, thanks for talking with us today.